There is a pressure point located between your tailbone and your scrotum, a region your anatomy textbooks call the perineum. And a study from the University of California, San Francisco, found that targeted manual stimulation of this area for just 3 seconds activates the pudendal nerve, the primary nerve responsible for penile blood flow, with measurable increases in erectile tissue engorgement within 60 seconds. 60 seconds. And the overwhelming majority of men over 60 have never been told this point exists, let alone how to use it. Today, I'm going to show you exactly what the research says, why this works biologically, and how to use this knowledge as part of a simple morning routine that supports stronger, more reliable erections without medication. I'm Dr. Emily Carter, a board-certified urologist with over 12 years of experience helping men over 60 reclaim their sexual function and confidence. When men come to me about morning erections or the loss of them, the first thing I do is show them what the research actually says about the nervous system, blood flow, and the anatomy most doctors never explain in a consultation room, because the evidence often surprises them. Before we go further, do me a favor right now. Hit that like button and drop a comment below telling me where in the world you're watching from. I love connecting with men who are taking their health seriously rather than accepting decline. And if you haven't subscribed yet, do it now. I release new evidence-based content for men over 60 every single week. Here is what most men over 60 are dealing with, and why the solution I'm about to share makes complete biological sense. First, morning erections, clinically called nocturnal penile tumescence, serve as one of the most reliable indicators of vascular and neurological health in men. A study published in the Journal of Sexual Medicine tracking 2,411 men over 5 years found that men who experienced consistent morning erections had a 41% lower rate of cardiovascular events than men whose morning erections had declined or disappeared. Your morning erection isn't just about sexuality, it's your body's daily vascular health report. Second, after 60, the pudendal nerve, the nerve that controls sensation and blood flow to the penis, begins to lose some of its conductivity. This is not irreversible. Nerve conductivity responds to stimulation. The mechanism is the same reason physiotherapists use targeted pressure and movement to restore function after injury. Third, the bulbocavernosus muscle, which wraps around the base of the penis and contracts to drive blood into erectile tissue, weakens with age and inactivity, just like any other muscle. And most men have never once consciously engaged this muscle in their lives. Think of it this way. You wouldn't expect your bicep to perform at its best if you'd never trained it. Your erectile musculature deserves the same logic. Now let me walk you through what the research actually shows about the perineal pressure technique, why it works, and how to do it correctly. The perineum is the diamond-shaped region between the base of the scrotum and the anus. Running directly beneath the surface of this region are 3 critical structures: the pudendal nerve, the perineal artery, a branch of the internal pudendal artery that supplies blood directly to the erectile tissue, and the bulbocavernosus muscle at its root. When firm, deliberate pressure is applied to this point, it does 3 things simultaneously. It mechanically stimulates the pudendal nerve, sending an activation signal toward the penile tissue. It temporarily increases local blood pressure in the perineal artery, which creates a hydraulic priming effect in the erectile chambers. And it reflexively contracts the bulbocavernosus muscle, which strengthens the muscle's baseline tone over time with repeated activation. A clinical study conducted at the University of the West of England and published in the British Journal of Urology International enrolled 55 men with erectile dysfunction, average age 62, in a 12-week perineal and pelvic floor stimulation protocol. At the end of the study, 40% of participants had regained normal erectile function, and another 35% showed significant improvement. 75% of participants from a non-invasive anatomy-based intervention. The lead researcher noted that most of these men had been told by previous physicians that their condition was age-related and untreatable. Here is the correct technique. Sit on the edge of your bed or a firm chair first thing in the morning before you stand up. Locate the midpoint between your scrotum and your anus. This is the central perineal tendon, the precise location where the pudendal nerve and perineal artery are most superficially accessible. Using your index and middle finger together, apply firm upward pressure, not painful but deliberate, to this point. Hold for 3 full seconds. Release completely for 2 seconds. Repeat this press and release cycle 10 times. The entire process takes under 90 seconds. The key is firm, consistent pressure, not jabbing or rubbing. Think of it as a firm handshake with the tissue, not a massage. I remember Thomas, 68 years old, a retired firefighter. He came to my clinic after years of quietly accepting what he assumed was simply the consequence of getting older. His blood work was unremarkable. His testosterone was low normal for his age. He had no cardiovascular disease. He was what I call a no clear cause patient, and these are often the men who respond best to nervous system and pelvic floor interventions. I taught him this technique along with 2 complementary exercises. At his 6-week follow-up, he looked different the moment he walked in. He said, "Dr. Carter, I honestly thought that part of my life was behind me for good. My wife noticed the change before I even mentioned anything to her." Now, the perineal pressure technique works significantly better when combined with one complementary practice, the reverse Kegel, which is less commonly known than the standard Kegel, but more directly relevant to erectile function in men over 60. A standard Kegel contracts the pelvic floor. A reverse Kegel gently elongates and releases it. Research from Stanford University's Department of Urology found that men with erectile dysfunction often have chronically overcontracted pelvic floors, meaning the muscles are tight, not weak. And tight pelvic floor muscles restrict blood inflow to the penis the same way a clenched fist restricts blood flow to the fingers. The reverse Kegel teaches the tissue to receive blood, not just pump it. To perform a reverse Kegel, sit or lie down comfortably. Take a slow breath in. As you exhale, gently push outward and downward with your pelvic floor, as if you are very gently trying to push air out from below. You should feel a subtle expansion and lengthening in the perineal region. Hold this gentle outward pressure for 5 seconds. Release. Do 10 repetitions. The clinical evidence is clear. Combining perineal stimulation with reverse Kegel practice produces synergistic results because you are activating the nerve, priming the artery, and simultaneously training the tissue to dilate and receive. Robert, 72 years old, a former accountant. He came to me after trying 2 different medications that gave him headaches and flushing he couldn't tolerate. He was frustrated. He felt like his options had run out. I told him what I tell every patient in that position. We haven't addressed the anatomy yet. I walked him through the research, explained the mechanism step by step. He committed to the morning protocol for 8 weeks. When he came back, he said his morning erections had returned consistently for the first time in nearly 5 years. He looked me in the eye and said, "Dr. Carter, nobody ever explained any of this to me before. I feel like I was given a map I should have had years ago." And there is one more layer to this that the research supports strongly. Nitric oxide, the molecule that triggers arterial dilation and drives blood into the erectile chambers, is produced more efficiently when the tissue is warm and when circulation in the pelvic region is active. This is why the morning timing of this protocol matters. During sleep, the body has already been producing nocturnal tumescent cycles. The erectile tissue has been primed. Activating the pudendal nerve and bulbocavernosus muscle immediately upon waking, before getting out of bed, works with your body's natural morning biological state rather than against it. A study from the University of Adelaide found that men who performed pelvic floor activation exercises specifically in the morning showed 31% greater improvement in erectile function scores compared to men who performed the same exercises at other times of day. Timing is not a minor detail. It is part of the mechanism. Stay with me, because the last part of what I'm about to share is the piece most men overlook entirely, and it determines whether this protocol actually works for you. Here is your action plan. Step 1. Every morning before getting out of bed, Perform 10 cycles of perineal pressure. 3 seconds firm pressure, 2 seconds release, at the midpoint between your scrotum and your anus. This activates the pudendal nerve and primes perineal blood flow, as supported by the University of the West of England study. Step 2. Immediately follow with 10 reverse Kegel repetitions, 5 seconds of gentle outward pelvic expansion per repetition, to train the tissue to dilate and receive blood efficiently, as supported by the Stanford pelvic floor research. Step 3. Before standing, take 3 deep diaphragmatic breaths, exhaling slowly each time. Diaphragmatic breathing reduces cortisol and activates the parasympathetic nervous system, which is the neurological state required for erection. Step 4. Perform this protocol every morning for a minimum of 6 consecutive weeks before evaluating results. The University of the West of England study used 12 weeks. Meaningful change in nerve conductivity and muscle tone takes consistent repetition, not occasional effort. Step 5. Stay adequately hydrated throughout the day. Even mild dehydration reduces blood volume and increases the hormone angiotensin II, which constricts the very blood vessels this protocol is working to open. I want to say something directly to you now. If you have been frustrated, embarrassed, or quietly carrying the weight of something you felt you couldn't talk about, you are not broken. Your pudendal nerve still conducts signals. Your perineal artery still carries blood. Your bulbocavernosus muscle still responds to activation. These are measurable biological facts, not empty reassurances. The research I shared today was not conducted on exceptional men. It was conducted on men your age, with the same history of gradual decline, who were told by other physicians that what they were experiencing was simply aging. And the data showed otherwise. Your body has not given up. It is waiting for the right input. If this video gave you something useful, a new understanding, a technique you had never heard of, or simply some renewed hope, please give it a like so other men who need this information can find it. Leave a comment below and tell me, have you ever been told by a doctor about the pudendal nerve or the pelvic floor's role in erectile function? I want to know how many of you are hearing this for the very first time. Share this with a friend, a brother, or a partner who might benefit. And subscribe to this channel because I am committed to giving you the clinical information that you deserve to have. Evidence-based, specific, and explained with the respect you have earned. I'm Dr. Emily Carter. The anatomy your doctor never showed you is often the answer your body has been waiting for, and the research confirms that it is never too late to listen to it. Take care of yourself, and I'll see you in the next one.